Well, thank you. I sure appreciate the opportunity that Rogers is giving for to be able to communicate with the public because really in times like this, communication is so essential. The one thing that we can say from the township's point of view is that this isn't something that we haven't been prepared for. We have an emergency team that is coordinated not only throughout the township, but also hooked into the county of Simcoe and the province of Ontario to deal with things like this. We do a rehearsal annually so that we make sure that we have things in place. So we are prepared for this and we're feeling fairly confident that we're moving along in coordination with everyone else and things are kept well within our control. The first thing to be above all that everyone should be doing is they should be listening to the health professionals and be doing what the health professionals recommend. First, and make sure that they rely upon the information that comes strictly from the professionals because we have a lot of social media things out there that can cause people to misinterpret what they should be doing. Well, the people that are healthy right now need to understand that no one is immune, and the research that's coming back is that it is not necessarily a problem for a certain age group, it's a problem for everyone. And certainly we need to be concerned about our neighbors and need to be concerned about other people. So healthy people have a real role in trying to protect those that are vulnerable, but they also have a real role in protecting themselves because don't forget, we need to keep a lot of people in the workforce in order to be able to sustain the food line and to sustain the economy, which is so essential. But one of the things that is surprising, that some people haven't considered, is that we have the notion today that everybody watches the news. I can tell you they don't. The second thing is we have the notion today that everybody has social media, they have computers, they have cell phones. I can tell you that they don't. And so one of the things that we need to keep in mind is there are different people that are looking for communication in different ways. One of the things that we know that's important is that we have the ability for people to be able to phone into the township and be able to talk to someone live, which will help allay the concerns and answer the questions. The other thing that we'd like to make sure everybody understands is that we are clearly in a position where the township can maintain its essential services, and we can see that in the foreseeable future. The township has not declared a state of emergency because the province has done that already, mainly so that they can access resources. Right now, the township is in a position where we feel that we have enough tools at hand to be able to deal with the issues that we have. We would only declare a state of emergency if we felt we needed assistance beyond that. First thing we've done is that we have closed our facilities to the public, and that's the township office. The second thing is we've shut down all our programs and we've closed down all the other facilities. We've also done a great deal in communication to make sure that our website is continually updated. The other thing that we need to all keep in mind is that no municipality is an island unto themselves, and unless you work in cooperation not only with the people in Simcoe County, you have to work with the people in the province of Ontario, you have to work in coordination with the federal government. So all of those things have to be coordinated, and what we've been doing is we've been in constant communication with the other levels of government. For example, yesterday alone, we were on a conference call that included the Provincial Minister of Health, Christine Elliott, the Minister Clark, and the Medical Officer of Health, so that we got communications directly from the province and to be aware of the things that they are putting in place that we can help facilitate by carrying them out and communicating with the rest of the public. And at the same time, we also have been in communication with our own local people on the ground, our Medical Officer of Health, our CAOs have conferences on a regular basis right across the county, and elected officials are doing the same. So we really need to work in concert, and we're doing that. We need to keep in mind when we talk about assessment centers that we're talking about something where testing may be uh, that would have to take place. And that situation is one where there needs to be a lot of protective situations for health professionals, and there needs to be a lot of protocols. So that would have to be conducted in relation to the hospitals where they have that medical expertise to be able to do. I know that there's been one that's been set up right now by the Royal Victoria Regional Health Center off-site, and people are under the belief that they can just drive down there and be tested, which is not the case. It's a case that can only be referred, and they'll only test if there's a valid reason for doing it. I think that where we're living in Simcoe County, and I'll say particularly in Oro-Medonte, how fortunate we are to have the health services that we have in place, and having all of the professional staff, both at the township level and right across the county and the province, who are well prepared and have anticipated these kind of things happening. So I think that we all can have a level of confidence that things are in good hands. And at the same time, we have to understand that everyone has a role to take in terms of this. I've been really impressed with where some of the business leaders have stepped forward and their leadership. For example, hearing that the grocery stores are having a time when people with compromised immune system potentially, and people who are more vulnerable have a chance to go in a much safer environment. I see that restaurants are adjusting in order to make sure that food is available to people. I'm also seeing that and it's really fortunate that we have all of the electronic communications that we have, where neighbors are checking in on neighbors. They're realizing that there's a number of people who are living alone that are in constant contact, and I know that the community as a whole are pulling together, and we're trying to do everything we can to facilitate that.